you for joining us. My name is Heather Vorse, and I will be your host for today's meeting. Today's presentation is Nutritional Considerations of ADHD and Autism. Before we begin, I have a few quick announcements. All callers are placed on mute to avoid interruptions during the presentation. To submit a question, simply click on the Question tab. At the end of our presentation, Dr. Grabowski will address the questions submitted. The presentation is being recorded and will be available at our website at www.spectracell.com in our Clinical Education Center. The slides will also be available on the site for download. At this time, I would like to introduce Dr. Ron Grabowski. Dr. Grabowski, SpectraCell's Director of Clinical Nutrition and Education, lectures on an international and national level. He has over 25 years of clinical nutrition experience that encompasses topics such as diabetes, heart disease, sports nutrition, renal disease, and gastrointestinal disorders. He received his clinical nutrition training at the New York Hospital, an affiliate of the Cornell Medical Center, located in New York City. And he has worked in various prestigious hospitals in the Houston, Texas area. Dr. Grabowski has served on the State of Texas Governor's Childhood Obesity Task Force and is a member of the American Dietetic Association, the American Chiropractic Association, and the Endocrine Society. In addition to his practice, he has developed numerous vitamin and mineral formulas for supplement companies. Professional athletes, including those of Olympic standing, seek his experience in nutrition consultation. Welcome, Dr. Grabowski.
Thank you, Heather, and good evening, listeners. I'm very excited about tonight's program because I think there's a lot of questions that have to be answered with this particular topic. On the other hand, I think there are things that we do know about this particular condition as far as ADHD and autism that actually cross over with one another and are related, and I think you listeners will find that out this evening, that there are some correlations with both of these conditions as well as other mental health conditions. As you can see, of course, certain characteristics that we look at for ADHD are the ones listed here on your screen. And even though the hyperactivity doesn't always occur with these type of individuals, we know there's, of course, ADD and, of course, ADHD. Those are things that we, of course, look for in regards to the diagnostic procedure. And literature shows that we are increasing this particular condition. And I think a lot of it is definitely due to the nutritional aspect in our daily diet, as well as certain biochemical abnormalities that we're becoming more aware of. You can see here there's certain tendencies, of course, that these kids develop, that they have the learning disabilities, especially in the math, reading, and spelling. But also, you can see that they say that there's approximately 3 to 5% of the school population has this condition. However, these particular statistics are about 3 years old. So I think when new statistics come out, I think we're going to see that they are actually a little higher than this. The one thing I think is very important about this tonight is not only the particular nutrients that are involved, but the correlations of one nutrient to another. And I'll get into that a little later in the program. One of the things that's very interesting about ADHD or ADD children is also when we see an essential fatty acid deficiency. And you can see here, here's a comparison that in the essential fatty acid deficiencies of those individuals, we see impaired growth. Of course, we see skin changes, whether it's dry, scaly skin. We, of course, see polydipsia as well as polyuria. If you look at the ADHD children, that they also have skin conditions. They also have, of course, the thirst types of tendencies. And once again, they have some respiratory conditions like asthma and also allergies. And we're going to talk about allergies and asthma later and how they may actually correlate with this, this particular condition and where there is a relationship with certain nutrients and these conditions. I think that's very important because one of the things that we're going to primarily emphasize tonight are certain nutrients, but I think we have to keep in mind that dietary changes are very, very important. And I think it's very important that if you are an allergist, that you more or less consider this. If you are dealing with these individuals, that you actually have an allergist become involved with these particular individuals, and or you do some allergy testing with these particular individuals, because there is strong enough evidence to show that when we have allergies, that it can cause some of these signs and symptoms. One of the things that, of course, is very important to keep in mind is how important the fatty acid content is of the brain. And you can see here next to the adipose tissue that the nervous system is the second largest organ or system that actually has a concentration lipid. What's important about this, besides making the actual fatty acid content of this structure, is how we protect it. And anytime we have fatty content of a particular organ or system, we also have to worry about lipid peroxidation and the inflammatory process, and of course we have to worry about the antioxidants that may quench the free radicals that develop from this particular section. And it's something that we look in, especially with athletes. We find out with athletes, because of the high fat content of the brain and there's an increased oxygen intake, that there is an increased demand for certain antioxidants such as vitamin E and glutathione. And so as a result, when we are dealing with children and or adults, that we have this high fat content, that we have to always be aware of the antioxidants to protect this fatty acid component. Two main, of course, products that have come into play that are in the literature, I've cited some of the research, is arachidonic acid and DHA. Of course, when we talk about the fatty acids, especially the omega-3 fatty acids, a lot of people talk about EPA and DHA. And even though EPA definitely has a role, we're finding out that DHA may be a larger component in the whole scheme of this particular condition as well as in autism. We know, once again, that these products can be synthesized by, of course, our essential fatty acids that are listed there. And as a result, that this is why we look at essential fatty acid deficiency and this particular condition, and why there are some signs and symptoms that correlate with both of them and are very similar that we have to take into consideration. And so if you looked into the literature back in the 80s and early 90s, of course, most of the literature, when it started to come out with ADD or ADHD, had to do with the fatty acids. And even though we're going to talk about those this evening, I think it's also very instrumental that we talk about certain particular nutrients that are also major players in the nervous system. Taking that into consideration, we know that zinc is very important for several enzymatic systems in the body. Of course, some say around 200 enzymatic functions. Now there's some literature out there that says anywhere from 250 to 300 different functions. And I think what's very important to keep in mind with this particular nutrient is not just the fact that zinc is important for brain development, but how do we affect this particular nutrient? For example, there's literature that shows that if we consume a high amount of folic acid, that folic acid may actually inhibit or affect our zinc status. And if you take that into consideration, one of the most common times that we will really consume a high amount of folic acid, and that's during pregnancy. A prenatal vitamin, once again, is very high in folic acid. Most of them have 800 to 1,000 micrograms. And at those dosages, it actually has been shown to affect our zinc status, in fact, make individuals zinc deficient. So when we're talking about brain development, of course, zinc is very important for that. And yet at the same time, here is a woman that's pregnant taking a prenatal vitamin, and if it doesn't have enough zinc in it, or she doesn't consume enough zinc in her diet, once again, she may actually be jeopardizing the brain or the nervous system development of the child. So I think that's very important to keep in mind. And one of the things that I've talked about in the past is, of course, a physical exam finding is leukonychia with, of course, zinc deficiency. So I've seen this in my practice quite a bit, where a woman usually gets into her second or third trimester, and she starts to show leukonychia on her nails, and of course, by that time she's taken her prenatal vitamin for several weeks, and it's actually caused some problems. And a lot of times when a woman is pregnant early on, she has morning sickness, she's not going to want to consume a lot of food, which also highly jeopardizes the zinc stature. Now, the thing that we have to keep in mind about zinc is the best source of zinc is actually our meat items, whether it's red meat or such as pork or beef, or chicken, various products like that will have a higher bioavailability of zinc, where even though people talk about, nuts and seeds and grains contain some zinc, the bioavailability of zinc from those products is very poor. So we have to not just look at the content of zinc in food, but also the actual bioavailability. And I think that's where we're going to be in the scientific literature. You can see here that zinc has a role in several different complexes, receptors. One, of course, the NMDA, as well as the adenosine A1 and A2A receptors. Of course, there's some medications that actually are related to the A2A receptor in regards to the effect on those. And, of course, one thing that I think is very important that we keep in mind is the production and or overall modulation of melatonin. So when we're looking at this particular nutrient, not only are we looking at development of the nervous system, but we're also looking at certain receptors. And one of the things I'm going to mention later is how zinc may come into play with thyroid function, because there is some information out there on hypothyroidism or thyroid dysfunction and some, of course, neurological compromise. Now, NMDA receptors also play a role with depression. And so it's also very important to keep in mind that this particular nutrient, when it's low, works with the individual, not just in childhood, but of course in later years if they happen to develop depression. And so I think it's very important to look at this particular nutrient and realize that it's very essential to the beginning or the early development of an individual. And for a long time, we've just, with a prenatal vitamin, that primarily emphasized three nutrients: B12, folic acid, and, of course, iron. And now we are looking at a nutrient like this that has a strong, once again, correlation with this condition as well as some other conditions with the nervous system. Another thing that we look at when we are involving certain neurotransmitters, of course, you can see dopamine and serotonin. And you can see that there's some research out there indicating that both of these neurotransmitters systems appear to be involved with ADHD as well as ADD. One of the things that we know that's very important about especially serotonin is vitamin B6 is required for serotonin synthesis. I don't have this listed here, but dopamine is also dependent upon vitamin B6. There's several nutrients that are involved with dopamine production, and a lot of people, when they talk about dopamine, especially in a condition like restless leg syndrome, they talk about iron and the relationship with our dopamine and, of course, restless leg syndrome. Well, B6 is also very essential for dopamine as well as serotonin. As you can see here, as I mentioned earlier, that zinc has a correlation with melatonin, and we're finding out now that, of course, melatonin regulates dopamine. And you'll see how dopamine actually comes into play when we're talking about this particular condition. Now, as I mentioned earlier in the statement about the zinc and dopamine relationship, and you can see here that zinc also has a correlation with the tryptophan to serotonin. So we look at zinc and dopamine connection. We also look at zinc and the serotonin connection. And so for this reason, that a couple of transmitters that have been involved with ADD and ADHD definitely require zinc. And this is where we talk about the actual conversion. And why I think this is so important is because later you will see that homocysteine is something that we'll talk about with these conditions. And a lot of times when people talk about homocysteine, they, of course, always relate it back to three major nutrients: B6, B12, and, of course, folate. And yet, in this particular case, you can take in B6 from a dietary source, but it has to get converted to the pyridoxal 5-phosphate, and it will not do that without zinc. So if someone has an underlying zinc deficiency and they're taking B6, hoping that it's going to make serotonin, that they're not going to be able to really do that. And so that's one of the reasons that you'll see me emphasize throughout this lecture tonight of objective testing, that we need some laboratory diagnostics in order to determine which particular nutrient an individual is missing. And I have a couple cases at the end of this lecture tonight showing you that when people have certain conditions, that we can't just pigeonhole them and say, okay, we're always going to give them B6 or we're always going to give them zinc because they may need it or they may not. And that's when I think sometimes the general public or even doctors don't get the results that they're looking for when they start supplementing these people with certain supplements. It's because they try to use the cookbook approach, meaning that they're always trying to use the same supplementation. And as we all know, as doctors, that no two people have the same biochemistry. So why should we treat these people the same? As we shouldn't. We should always treat people on an individual basis. One of the things that's a concern, of course, in a relationship with dopamine is, of course, how it regulates our appetite. And, of course, and this is one of the reasons why that some of the medication out there that's actually used for ADD and ADHD actually causes an individual to become anorectic, per se. And you can see here that dopamine actually mediates the way that we do consume food. And one of the things that we have found with dopamine, especially the medications that affect dopamine, is that it doesn't just affect our total energy intake, but it seems to affect more of the intake of fatty items or foods higher in fat. And they've actually shown some research on this where when individuals were on medication that were consuming a reduced amount of food, and it seemed that they were reducing it primarily in that area. And this is where the methylphenidate actually comes into play. As you can see in short-acting methylphenidate, that it increases the dopamine by, of course, blocking its reuptake, and so more or less the dopamine reuptake inhibitor. And it's been shown to, once again, reduce the overall energy intake. And this is a concern if a child is trying to grow and develop, is that we're on this medication for, of course, these signs and symptoms that we're trying to control, but at the same time, are we actually going to somewhat affect their normal growth pattern and their overall development as an individual? And as I mentioned earlier, that one of the things that this does is it seems to really affect the reduction in dietary fat. Well, you say, well, that might be a good thing because maybe it will prevent these individuals from having high triglycerides or high cholesterol. And even though that's true, what I think is really important is when we start to cut out fat in an individual's diet, we have a very good chance of cutting out the essential fatty acids. And as I mentioned earlier, the essential fatty acids are very, very important and very closely related to this particular condition. So, if we were cutting out the carbohydrates or cutting out the protein, that would be one thing. But since we do know that the essential fatty acids have a part to play with arachidonic acid and DHA, that maybe that's not such a good thing that this particular type of medication is actually inhibiting a source of something that has been shown to be beneficial, in this case, of course, the essential fatty acids. The good thing is, once again, as you can see here, that dopamine levels, if a person is overweight or obese, that, once again, we can affect their feeding behavior and, once again, control maybe their possibility of not developing another pathology such as maybe diabetes. So this is where in the human research, once again, they've also seen this in animal research, but in human research, we're seeing that lower levels of circulating dopamine, once again, can be related to, of course, eating disorders. When we increase, of course, we can shut down those eating habits. Of course, you can see here in the second bullet that these particular individuals, and this is true in adults or in children, that if we consume high amounts of sugar, like sucrose, or just a simple carbohydrates, whether it's fructose and or glucose, that it actually stimulates the release of dopamine from the epidermis shell of the brain. And so, once again, another possibility of increasing the chance of obesity. But I think what's very important about this, and I see this in my practice, and you might see this as well, is that a lot of kids that do have ADD or ADHD have a tendency to go towards the simple carbohydrates. Now, once again, when they're on medications like the methylphenidate, that they don't necessarily go that, or they go with carbohydrates and they cut down the fat. But once again, I've seen certain things like chromium deficiencies, and of course, we talked about zinc earlier. And zinc, of course, has a correlation with glucose regulation, as you know, its relationship with insulin. So Some of these individuals are zinc deficient, and at the same time, zinc is very important for, once again, the overall utilization of carbohydrates. So I think when they're zinc deficient, they're going to have a tendency to also want more carbohydrates. And we see this in diabetics. I see this in hypoglycemic individuals. I see it in these particular individuals that have ADD and ADHD. So what has actually been done in regards to diagnostics? And you can see here that zinc levels in the blood have been shown to be correlated with ADHD in comparison to control subjects in numerous countries. It's not just in the United States, but it's been throughout the world that we've seen this correlation. What's interesting about the more like the appetite and the relationship with the mental status of an individual is in, I'm going to go off subject for a little bit on the condition of anorexia nervosa. In anorexia nervosa, we know that zinc plays a part in that particular pathology. And that we have found that when people have anorexia nervosa, that they have a tendency to have low zinc levels. So we know that zinc has a major role in the central nervous system, whether it's ADD, ADHD, whether it's autism, whether it is anorexia nervosa, depression, and I think it's very important to keep in mind. Now, I don't have this listed in these particular slides because, once again, there's a lot of information to take you this topic. But whenever we look at zinc, we always have to keep in mind copper. And even though copper hasn't really been mentioned in a vast amount of literature, especially in this topic, it has been in the central nervous system relationship has been associated with the myelin formation in the brain and peripheral nervous system, is that if we give zinc, we always have to monitor copper. And we should look at zinc to copper in no larger than a 10-to-1 ratio if you supplement them. Of course, it's a lot easier to have a high zinc content than it is a high copper content, so you don't really see much zinc deficiency with copper supplementation because it's, once again, at a lower level. So going back to the long-chain, of course, polyunsaturated fatty acids in the human brain, you can see here that we have, on the average, about a 15% of the total fatty acids in the human brain are predominantly, as you can see, DHA and Arachidonic acid. So when we have investigated the literature, once again, we have seen that DHA is a major player. Now, once again, one of the things that happens, and I see this in my office with parents of these children, is they read a little bit of literature on DHA or omega-3 fatty acids, and they start supplementing, but they don't get the dosages that actually has been shown to be beneficial. And I will talk about that dosage in a few minutes in relationship to this condition, but it's true in these other supplementation or these other nutrients that we're going to supplement, is you have to give adequate amounts. And one of the things you're going to see in this particular presentation tonight is these individuals, just like autistic individuals, have some genetic defect in certain cases, or their metabolic pathways may require a large amount. And what happens a lot of times is parents give these kids like 50% of the RDA or 100% of the RDA, like say with zinc, and sometimes these particular individuals need larger amounts to more or less complement or due to the defect in a particular biochemical pathway to kind of like override that pathway because the 100% of the RDA is inadequate. So that's where, of course, they need to be under doctor's care, is because if you're going to start pushing therapeutic dosages of certain nutrients, you need to make sure that you're not causing some problems elsewhere. So once again, as I mentioned earlier, that we've seen some correlation with the actual brain development, but once again, as I mentioned, with the brain and also the eyes, and they've seen some correlation, of course, with eye abnormalities in these particular children and even in adults, that when we are dealing with the essential fatty acids, especially DHA, that there's several functions that we have seen with this particular group of products. And I think it's very important that we address this, and this is very important, of course, during pregnancy. And once again, it's very important that we emphasize to the female that not only do we need the folic acid, B12, and iron, but we have to highly encourage the intake of the fatty acids. And of course, if a woman is under the care of an OBGYN that's really trying to restrict the calories, the most common area that's restricted are the fats. And once again, we usually consume more of the saturated fats versus the polyunsaturated fats if we limit our fats, and that causes some of these abnormalities. So one of the things that you can see here is both of these, the DHA and the arachidonic acid, accumulate very rapidly in neural tissue. And this is extremely important, once again, during, of course, the infantile years, but once again during the pregnancy. And this is one of the reasons why we're seeing DHA being added to baby formula. But once again, if a woman's breastfeeding, it's very essential that she consumes enough of these particular items. And one of the concerns, of course, with most women after they've delivered a child is weight loss. Is, I have to cut down my calories. I want to lose the weight that I gained during the pregnancy, and once again, it jeopardizes certain things. So this is something that we have to emphasize to the female, and also some of the things that develop during the pregnancy as far as other deficiencies. So you can see here that there are several functions of DHA. And of course, one of the things that people have talked about with DHA is the function of the neurotransmitters. But one of the other things that a lot of people are talking about today in the function of DHA is the membrane fluidity. And another term that's used, and I don't have this on this particular slide, but it's noted quite often, is what we call the plasticity of the brain tissue. And more or less what they are talking about when they talk about the plasticity is the ability for those cells, the brain cells, to accept or be affected by neurotransmitters as well as nutrients that are allowing it to those particular tissues to function. So I think it's very, very important that we understand that it's just not the neurotransmitter function, but it's other nutrients that are going to be affected by the ability of the membranes of these particular cells. So these individuals may be developing enough of a particular neurotransmitter, but whether or not that neurotransmitter actually works is going to depend upon the actual cell integrity. And that's something that's very important. That's why when we do introduce items like DHA into the individual, we're not going to change that person's brain tissue overnight. We're not going to affect it like we would with a medication that may have a very short half-life. So one of the things we have to emphasize to the parents is this is a long-term process. We have to develop this product into the individual. It's going to take several weeks or months to actually affect their tissue before we see that. So if a person, a particular parent or parents want to maybe decrease the medication or maybe eventually get their child off of medication, if that's one of the goals, is then, once again, realize that it's going to take several weeks or months to do that. Once again, we talked about dopamine and the relationship of zinc, and now you can see here as well that we have seen a relationship of dopamine transmission and DHA concentration. So this is what I was talking about, is like the neurotransmitter effect. So an individual technically could have adequate zinc to affect dopamine, but they don't have adequate DHA content, and so that dopamine is not going to work on the neural tissue until the membranes are affected. And that's what's very important about this particular concept. It's not just a one nutrient thing. And I've seen this, and you've probably seen this in your practice, where a particular patient or parents will come and say, I've tried fish oils with my child and it didn't work, or I've tried zinc with my child and it didn't work, and I read this in an article. Well, it's not that simple. I wish it was that simple. I wish it was that we could give DHA to everybody, that would be it, which is zinc to everybody, and that would be it. But as we know, it's a very complex system. So once again, when we're looking at these particular individuals, something that we have seen in correlation with essential fatty acid deficiencies and DHA is, besides the concentration of this particular product of DHA in red blood cells or plasma, we've also seen that these children have a tendency to be thirsty, like I said, the polydipsia, and also have shown signs of polyuria. Those particular two symptoms also are very closely associated with essential fatty acid deficiency. So when we look at these particular individuals and when you're evaluating an individual, two questions that you definitely want to ask the parent and or the child is, are you thirsty a lot and or do you urinate a lot? And of course, most children don't drink a lot of water. They may drink juices, but they don't drink a lot of water. And of course, even though that may have a tendency to cause them to go to the bathroom, it's an abnormal frequency. So once again, when we look at this, then next thing is we look at the individual is what are their skin presentations? Do they have dry skin? Do they have eczema? Do they have any signs of dermatitis? Do they have certain dermatological findings that correlate with the thirst and the urination? You can see here that in order for the DHA and EPA to be synthesized from, of course, linolenic and linolenic acid, it has to go through various steps. And these particular steps, of course, are involving, once again, various systems and various micronutrients. And I think that's very important to keep in mind because anytime we talk about enzymes, we, of course, are talking about protein content of the child or individual and also micronutrients that affect enzymes. And as I mentioned earlier, zinc and magnesium have a high correlation with enzymatic function and development. Now, as you can see here, when we look at the N6 fatty acids versus the N3 fatty acids, the different sources that we are looking at. And one of the things that we're concerned today with the intake of the N6 versus the N3 fatty acids is that they compete for the same enzymatic function, their systems. And as a result, if we take in a large amount of the N6 versus the N3, that we are going to have an overall effect on the ability to, once again, synthesize the DHA and EPA. So, and we've seen this in various pieces of literature, even outside this field, that the general public today consumes a much higher amount of the N6 versus the N3 fatty acid. So I think it's very important that we emphasize that, and I think giving you this list here on how we should push our patients that direction to the N3 versus the N6. And there's some speculation, and some people say we want it at a 2-to-1, some people say a 1-to-1, some people say maybe a 1-to-2 ratio. But there's been some literature out there that's actually shown that we may actually consume the N6 to the N3 at about a 15-to-1 or even a 10-to-1 ratio, which definitely will then compete for the same enzymatic systems. Something else that comes into play is iron. Of course, this is something that we look at very closely during pregnancy. The individual, if she's fatigued, of course, we always try to measure her iron levels or ferritin levels. And one of the things that we've seen with these particular individuals is their sleeping habits with the relationship of iron. And, you know, most of the time when we look at ferritin levels, the ferritin range, depending upon the lab, is around 10 to 12 as far as the bottom number, and it goes up to around anywhere from around 200, depending upon the lab that you're using. And usually if people are within that range, they think everything is fine. Well, the thing that's interesting about this particular element or this nutrient is that, let's correlate it back to what I talked about earlier, is restless-leg syndrome. In restless-leg syndrome, we have found that when an individual has a ferritin level less than 50, they often will have an exacerbation of their symptoms. And yet, the range, the bottom end of the range, is usually, like I said, 10 or 12. So if a person comes in with a 15 or 20, they say, oh, no, you're within normal range, we don't have to worry about your iron. So it's not just the range that we need to be concerned about, it's what we see as far as the signs and symptoms and how they correlate. Iron, as we know, is definitely associated with dopamine and dopamine receptors. So this is why about 15, well, depending on who you read, 10 to 15% of people that have restless-leg syndrome have an iron abnormality. And so we see this in pregnancy, that women seem to have a higher incidence of restless-leg syndrome during pregnancy. Once they deliver the child, their iron levels improve, and the restless-leg symptoms more or less disappear or decrease. Why? Because also we have the ability to make dopamine or effective dopamine receptors via the iron. So going back to this fact about the ADD or ADHD is that there are several things that we have to consider with those individuals, and the main things is the essential fatty acids. We have to look at the zinc, of course, content. There is some correlation with vitamin D. I haven't talked about that. There's also some correlation with carnitine, which I'm going to mention later in one of the case studies. That is very important to also keep in mind. Now moving on to autism, of course, there definitely has been an increased interest in autism and, of course, what we call alternative medicine. And you can see here that the involvement has been over 70% with this particular condition, whether it's true autism or autism spectrum disorder. And so more and more people are interested with this particular condition and how nutrition plays a part with this. And you'll see, I think, that there is a connection or relationship between ADD and autism. So when we look at, of course, an autistic individual, these are some of the things that are noted in the literature. Of course, we know that there's a behavioral impairment. One of the things that a lot of people, I think, overlook is the prevalence of GI involvement. And I think this is very, very important to keep in mind, especially when we talk about allergies or intolerances, but primarily allergies. And of course, one of the major allergies that we look at is wheat allergy. And so once again, is it wheat? Is it actually gluten? What's actually causing the problem? But I'm going to show you that there is some correlation with inflammation in the gastrointestinal tract and this particular pathology. Autoimmune disease correlations have also been considered with autism, of course, mental retardation. And of course, we do know that males are affected more frequently than females, and this is known to be at about a 4-to-1 ratio. So what do we know about autism and some of the research studies out there? Well, there's definitely a correlation with oxidative stress. These are just a few of the citations where we have found this. You can see it's been noted in the early 2000s or 2002 with the prostaglandin leukotriene essential fatty acid journal. We've seen it in 2004, 2006. I think there's several other pieces of literature that more or less are looking at this. The problem that I see with this is we try to attack this condition after it's occurred. Instead of emphasizing to the mother or during pregnancy or to the parents early into infancy that we need to evaluate and we need to really address the child's nutrition, it's like, well, wait till see if the child's healthy and they seem to be eating well, they seem to be consuming formula or breast milk, or once again, as they get into the finger foods later into the infantile years, that then we don't really address any major things, or we just think about the RDA. And it's a lot more involved than that. I think you'll see that in some of the slides here, that there is some, whether it's genetic differences or some dosages that really have to be considered. One of the things that, of course, has come up a lot in this particular condition, and this is worldwide literature, is the relationship with glutathione. And we have found that the cysteine levels and the glutathione levels have actually been altered in these particular individuals. And you can see here that a large portion, around 80% of the glutathione synthesis occurs in the liver, and then when from there it gets exported to the plasma and is hydrolyzed, of course, to cysteine and eventually cysteine. And that particular product then is uptaken by the tissues, primarily the brain. And once again, as I mentioned with the ADD, is the brain tissue has a large amount of lipids, and anytime there's a large amount of tissue that contains lipids, you're going to look at a high prevalence of oxidation or peroxidation. And so you're going to see a lot of free radicals. And I actually, one of the cases that I'm going to present tonight is one of my patients, and you're going to see that this individual actually had a glutathione abnormality. Not once, but twice. And the reason why I retested him, because once again, we wanted to make sure that his levels were being satisfied. In some nutrients, it was being satisfied, and this particular nutrient was not being satisfied until I increased the dosage. And once again, that was through objective testing. So what are some factors that actually affect glutathione? We know, of course, that if a person becomes exposed to a virus, that once again, it causes increased tendency to lower the glutathione levels. Of course, certain nutritional deficiencies, whether it's glutamine, whether it's B2, whether it's cysteine, those particular deficiencies can cause glutathione deficiencies as well. And then, of course, the inability for, once again, the detoxification process is as people take medications, and I think this is very important to keep in mind with looking at ADD and ADHD as well as autism, is people may be taking medications, or the mother may be taking medications during pregnancy, even though we try to limit those. Is it causing a stress on the liver that's causing an impairment in glutathione synthesis? And I think that's extremely important to keep in mind with this particular nutrient, is not assuming that we can make this product, but knowing that we have the right nutrients to do that. So another thing that we've looked at, besides, of course, the glutathione, is the methylation capacity. And, of course, in addition to methylation capacity, is the antioxidant capacity. And so the first thing I'm going to talk about here is things that we have seen with the methylation capacity. Is, of course, and I have a picture of a pathway here to more or less summarize this out. But when we've seen, and when we've evaluated the autistic children, one of the things that they have is a decrease in the methylation capacity. And what they've done actually in the research is to evaluate the SAM versus the SAH, or the S-adenosine homocysteine ratio. And they've seen that there's a decrease in this particular ratio, which shows that there's a decrease in methylation capacity. So we know that methylation pathway has a role in this condition. And once again, this is another reason why I think we have to look at the quality of supplementation that we're giving these individuals, whether it's an adult and or a child, in this particular case, children, is not just trying to use cobalamin or cyanocobalamin, but the methylcobalamin forms or the methylfolic acid forms are going to be a better utilized product than some of these other forms. And I think we really have to address that with this particular group. Then, of course, as I mentioned earlier, we see that these individuals have a decreased antioxidant slash detoxification capacity. And one of the major players, once again, is glutathione. And so we've seen a reduced glutathione level, and we've seen the increase in oxidized disulfide form of glutathione. And that's more or less what this is showing, this, that we've seen a decrease in this ratio as well. So we know that there's an antioxidant problem in this particular case, glutathione, and once again, we know that there's a methylation abnormality in these particular individuals. Now, one thing that I think is very important is to see if the mother and or father have these problems. And once again, I think it's very important to look at the diagnostics of the mother and the father, but definitely the mother as she's carrying the child in pregnancy to see if she's having any deficiencies. And I hate to say this, but too many doctors out there are still relying on the serum folic acid levels, the serum B12 levels, and the literature clearly shows that they are not very sensitive testing procedures. So if we're going to keep ordering serum B12 and serum folic acid and think that we're really evaluating the true status of those nutrients, then I think we're going to overlook something very important, such as this condition. And once again, we've seen that there is an overall increased oxidative stress. So once again, looking at these particular nutrients that are involved with the methylation process, two major nutrients that we've seen are once again the B12 and folic acid. But in this particular case, they've actually shown that the methylcobalamin and the folinic acid have shown to be of clinical benefit to some of these children. Not once again all of them, but some of these children who have autistic behavior or presentation. And once again, it's not just that, but we also have to look at the antioxidants. So besides just looking at the transmethylation metabolites, we also have to look at the antioxidant status of the glutathione redox status, and as a result, evaluate it. Now, this was published in the American Journal of Clinical Nutrition in January 2009, and more or less what it was talking about is some of these abnormal pathways with autistic children. And they've shown the B12 abnormality, of course the folic acid abnormality, we've seen the homocysteine / glutathione abnormality, and this is more or less summarizing what some of those previous slides showed you. The problem is, what we've seen is the effects of these pathways actually affect DNA synthesis or repair and proliferation. It affects overall cellular methylation and also affects the glutathione homeostasis. So this is an extremely important pathway. Now, what's not on here are some other things that are involved. And I don't have this in the notes per se, but if you're familiar with this pathway, betaine comes into play, choline comes into play, B2 riboflavin comes into play, choline comes into play. So those particular products also have to be considered. And that's why it's very important that we check these individuals for all of these nutrients. We just don't look down this tunnel and say, okay, we're going to give them B12, we're going to give them folic acid, or a product like glutathione. Now, something that, as I mentioned earlier, that has a correlation with both ADD and ADHD as well as autism is dopamine. And what's interesting is magnesium has a relationship with dopamine, just like zinc has a relationship with dopamine. And if you look at the NMDA receptors we talked about with zinc, well, magnesium also may have an effect on these receptors. But if you look at below that on the next bullet, it says with the B6 that magnesium salts have been shown to benefit 40% of patients with autism, possibly by the effect of dopamine metabolism. We know that magnesium has a correlation with dopamine. What's interesting about this, we've seen magnesium relationship in dopamine with premenstrual syndrome, that some of the women that have some of the signs and symptoms of PMS are affected with dopamine levels, and also, once again, magnesium seems to affect the same thing. So, as you know, magnesium has more functions in the body than any other nutrient, and it's very easily affected. And we've known this for several years. Back in the early 1990s, as you can see, we've seen some correlation with this particular nutrient. Vitamin C and glutathione, how do these two relate to one another? Of course, we know glutathione is a very powerful antioxidant. Well, vitamin C or ascorbate has also been very important. How it does, its role, especially in this particular case, is the preservation or the sparing effect of glutathione. And so this goes back to, once again, when doctors will supplement an individual with, say, N-acetylcysteine that converts to glutathione. If the person has a marginal or a low vitamin C status, that it's not going to spare the glutathione the way it's supposed to, and as a result, it's not going to scavenge the free radicals like we're anticipating. So once again, we need to be looking at objective data and saying, how do I know that this particular supplement or supplements are actually doing its job? And I relate it to something that we all do on a regular basis. If we treat people for cholesterol levels, how do we know that the niacin or the statin medication is working? We recheck that individual. We check their cholesterol levels to see that the dosage that we're giving, whether it's niacin or a statin or some other medication or product, is doing its job. The same thing has to be true with these particular nutrients. If we know or have a tendency to find certain antioxidants that are abnormal, how do we know which one is abnormal unless we do some objective testing? We've seen that inflammation has a role in autism. We've actually seen that pro-inflammatory cytokines have been noted in the literature. It's actually been shown to damage the brain. Once again, glutathione has come into play with this particular chronic inflammation. We know that chronic inflammation depletes glutathione levels. So once again, we'll perpetuate this particular problem. And once again, we know that there's a relationship with the gastrointestinal tract. So this goes to our next step, and this is what I was talking about earlier, is what about the GI tract status and autism? And, it's something to think about with children, but also with the adults, okay? Especially, like I said, the mother, if she has some history of Crohn's disease or ulcerative colitis or even irritable bowel syndrome, and with children, whether it's ADD or ADHD or autism, is do they have any allergies that are causing some inflammatory process, which once again increases the mucosal permeability, which a lot of people know, or sometimes termed the leaky gut syndrome. So taking that into consideration, we need to do some diagnostics. And talking about the methylation pathway, there's numerous nutrients that come into play. As you can see, looking at the left, B2, B6, B12, folate, choline, the glutathione, the cysteine, all of those have a correlation with the methylation pathway. Then we get into zinc and dopamine and magnesium and dopamine and vitamin C and the relationship of sparing glutathione. So you can see, I think, that it's not just a simple, let's try this vitamin or let's try this mineral. These are some of the major ones that have to come into play. And I'm going to address some of these questions tonight on how some of these play a role in other pathologies. Then in addition to looking at those nutrients that have been correlated with some of these pathways that have been associated with these conditions, we have to look at homocysteine as a diagnostic feature. We have to look into the gluten sensitivity with the gliadin antibody. We have to do general allergy testing, or not general, but I mean we have to consider allergy testing with these individuals. And as I mentioned earlier, we have to consider iron as a role. And the question is, and I think you have to look at, in the mirror and say to yourself, am I doing all of these diagnostics on my kids to really see what nutrient or nutrients may be involved or what allergens may be involved? And like I said, some of you may be giving B12 and some of you may be giving N-acetylcysteine, and you're helping some people, but you can see it's not that simple and that it has to involve several nutrients or several considerations with these particular individuals. So I have two case studies I want to present here that more or less correlate with a couple conditions that we talked about. Okay, here's a 3-year-old male. Once again, this is a patient of mine, and you can see here that we did spectral cell testing with this individual in January 2009. And if you look at this particular individual's deficiencies, B12, the phenphenate, this person had glucose-insulin interaction, chromium and glutathione, and the Spectrox, which is a test that spectral cell performs. It actually looks at the coordination of all your antioxidants and whether or not they're coordinated with one another or they're in balance, was also abnormal. Now, we started supplementing this individual, and this individual was getting large dosages of B12, the methylcobalamin form, and the mother and father, definitely by the time I saw them in May and June of the same year, said that they've seen some improvement. We did a follow-up testing on this individual. You can see that even though we corrected the B vitamin deficiencies, we corrected the chromium deficiency, we even corrected the glucose-insulin interaction abnormality, you can see that the glutathione and the Spectrox abnormalities were not corrected. So at that time, I had to readjust the dosage. And of course, we were giving this child N-acetylcysteine as a result to help the glutathione. Once we did that, of course, we then have to look at the follow-up in regards to the glutathione status. But the point is, even though the parents had noticed some improvement, I noticed improvement on the follow-up visit, is that we couldn't just assume that the supplements that we were giving this child were correcting the deficiency. Even though I was giving this child at a therapeutic dosage of N-acetylcysteine, for this particular child, it was not adequate. And once again, it was above a level that would be considered, a so-called RDA level. It was in a therapeutic dosage, and that's what we're finding out with these pathways. This is an individual, once again, a 10-year-old male that has ADHD, and I mentioned this earlier, that carnitine has a role, of course, we know with the mitochondria, we know it has a role with fatty acid metabolism, and we're finding out that even though some individuals may be taking DHA or DPA or essential fatty acids to help the condition, if they are missing carnitine, they're not going to fully utilize that particular nutrient. As I mentioned earlier, methylation problem, glutathione's involved, B12's involved, and there's some literature, of course, how vitamin D is involved with depression and other central nervous system conditions, along with the immune system. And I think there's, we don't know everything about vitamin D and how it may correlate with ADD or autism or some of these overall autoimmune diseases, but we do know that there is a strong relationship with vitamin D and lymphocytes. Then, if you look at the marginal levels, we see that B6 was marginal and cysteine. So both of those nutrients, once again, correlate with the methylation pathway. So even though they're not deficient now, they were at a level which we consider marginal that have to be addressed. Then you look at this person that is taking, this particular child is taking medication. And as we know, most of the medications today are affecting the liver. They have some stress on the liver, they have to be metabolized by the liver, or once again, they have some alteration of the liver. And as a result, the body has to help protect the liver through the antioxidants. And the major one is, of course, in the liver, is glutathione. So something to consider looking down the road is if we keep these children on medications, even though they may be helping their signs and symptoms, are we affecting their liver to the point that we're causing a higher demand of a particular nutrient or nutrients that are actually causing further detriment to this child, or put the child in a situation that the medication has to be enhanced as far as dosage, or they have to be changed to a different medication. So I think it's very important, and I try to emphasize this to my parents of these children, if your child may not get off that medication, but we need to give them nutritional support. So one, that can help their systems as far as the nervous system and their liver, and once again, prevent further depletion of these particular nutrients that have been correlated with these particular pathologies. Of course, everybody would like to think that they'd like to get off medication, but at the same time, that's not possible in some of the cases, and maybe a lot of the cases. But the point is, can we do something nutritionally that can enhance the efficacy of that medication? And once again, and will protect the individual from damage of a particular organ or organs. So taking that into consideration, once again, like I said, I know that it's a very interesting topic, the topic, the autism and ADHD. There's a lot of questions that still need to be answered, but at the same time, we do have some information out there that has some correlations with nutritional products and some common things between, once again, ADD and autism in the central nervous system. So now I'm going to open up to some questions that are submitted to our presentation. So, Heather, if you want to.
Okay, we have received quite a few good questions, and actually we got one regarding supplementation and how long that will take before you do see an improvement with an ADHD or autistic child.
Usually, I've seen that when we're dealing with the nervous system, that we're usually looking at least 5 to 6 months before we start to see some change. Now, it all depends upon the nutrient that's involved. When we're talking about a significant antioxidant like glutathione or the antioxidant system, it's going to take us longer because we have to balance out the various antioxidants. When we're talking about something like vitamin B12 or folic acid, those usually seem to show some improvement in about the 4th month, sometimes the latter part of the 3rd month. Only, though, I can say this, if you are giving the proper dosages. And once again, if you are trying to give, like, 50 micrograms or 100 micrograms of B12 to an individual that has a significant abnormality with B12, you're probably not going to see any results. And I'm telling you that I've seen this in objective testing with individuals that you need to push the 500 to 600 to 1,000, sometimes to 1,500 micrograms or even higher. But the only way you're going to know that is through objective testing. Is give them a dose, see how it goes. Once again, monitor certain markers that we know are reliable, not the serum B12 levels that a lot of people are trying to do, because I can give you a very large doses of vitamin B12 today and check your B12 before I do that, and your serum B12 tomorrow or the next day is going to be very high. But that doesn't mean that it's satisfying the biochemical pathways, and that's what's very important.
Great. We also had quite a few questions regarding diet. Sometimes when taking the medications, obviously the appetite is affected. So what type of diet, what are the best food choices? We had questions about a high-protein diet, or perhaps does gluten affect this at all?
Well, once again, one of the things I think that has to be considered is because there is information on the gastrointestinal inflammation and allergy relationship is, I really think we have to check these people out for gluten sensitivity, wheat sensitivities, or even other allergens that may be present in individuals. It's not going to always be gluten. It might not always be wheat. It might be eggs. It might be something else. But we have to address the gastrointestinal tract. So that's one thing I think that has to be taken into consideration. The other thing is is where are we getting a lot of these nutrients that have been shown to be beneficial? I mean, zinc is highest in your meat products. So when people say, well, I found my patients do better when I put them on a high-protein diet. Well, when you do that, in essence, you are giving them a higher zinc-containing diet. One thing I think that's very important that we have to consider, even though some of these medications really affect the intake of fat, is we need to address the high essential fatty acid products. And I've listed some of those in my previous slides. So I think it's very important that you refer back to that particular slide that shows those sources and get those into the children. And I think, when some of these medications are taken, they actually cause the child to abstain from those foods. What I've seen with those medications, a lot of them, whether it's an amphetamine product or a dopamine reuptake inhibitor or even a epinephrine or some other particular neurotransmitter that's involved, is people have a tendency, and this is as well as depression with adults and children, have a tendency to go towards carbohydrates, especially simple carbohydrates. And as I showed you in one of the slides, how simple carbohydrates affect our dopamine. Well, the dopamine that's important for us has to be produced, but it has to be produced by the assistance of certain nutrients. And give me a good example, I'm going to go away from the subject for a second, is when women that have severe PMS, and one of the symptoms of PMS is craving for sweets, one of the things that I've shown these individuals of cutting off their sweets is to give them magnesium. And people say, well, how does magnesium work with the cravings? Well, one of the things it does, it affects insulin receptors, but it also has an effect on, once again, dopamine. So we're affecting a neurotransmitter as well as affecting a hormone, and that's how they can benefit. So I would definitely push more towards a higher protein diet, a essential fatty acid containing diet, and then rule out any allergens.
Excellent. And we had a couple of different questions regarding DHA. One, if you suspect or actually know that a child didn't get good omega-3 diet or supplementation during their very early development years, can you, in a sense, make up for that, or should you be more aggressive in that supplementation? And are there any side effects for DHA?
Well, when you say the side effects, one of the things that we have to look at is usually the dosages that are recommended that have been shown to be beneficial in the literature, and it's usually been between 400 and 800 milligrams of DHA. We haven't seen any significant abnormalities or side effects with those individuals. We've seen benefits in even adults, so we know that the plasticity of the brain and the neurotransmitter effectiveness can be continued with DHA consumption throughout adulthood. So, can we make up for that, or can we have some effect on it? Absolutely. We can see that adults as well as in children. So even though a child may not have consumed enough essential fatty acids to make the DHA or has taken enough DHA in their diet in early years, don't give up on it. There's some very nice evidence coming out where the relationship with DHA and neural function and other pathologies have been affected on a positive note. One of the things we have to keep in mind is that omega-3 fatty acids have an anti-inflammatory effect. So once again, one of the things that has been shown to be involved with, especially autism, is the inflammatory mechanism. So, not only does it affect the neural integrity, but it also affects the overall inflammatory response. Now, one thing I want to emphasize with DHA is there's different types. There's an ester form and there's a triglyceride form. And it's been shown that the triglyceride form is the more effective form. And once again, you have to find out from those companies what they're more or less providing. Is it a triglyceride form or an ester form? And the triglyceride form is the preferred form. Next question.
Okay. And the final questions are really just regarding the quality of supplements and where can you get a high-quality DHA supplement?
Well, that's what I'm saying is that there's various companies out there that have the high quality, and the thing that you want to find out from those companies is the ester form, is it the triglyceride form, and where are the sources? The thing that we're worried about today with omega 3s from, say, the fish from the ocean is that, do they have mercury in there?
That brings us to the close of our presentation today. And just as a reminder, Dr. Grabowski is available for consultation on the phone for individual questions. Just send an email to webinar@spectracell.com. Again, that's webinar@spectracell.com, and we will make the arrangements to schedule that consultation with you. Again, the slides will be posted on our website at spectracell.com. And please don't forget to register to join us for next month's presentation, Nutritional Considerations of Diabetes Mellitus. Thank you, everyone. Have a great night. Thank you, Dr. Grabowski.
Thank you.